Ladies and gentlemen, I am Dr. I'm a senior expert on technology, Department of Corrections, Thailand. And there is Mr. Kanisak Chandrapipat, Director of Primary Care Commissioning Cluster, National Security Office, Thailand. Today, we would like to share with you the development of healthcare system in Thai detention settings. And it has three parts. First, I would like to give you a brief overview of Thailand and the main point of the Thai DOC. And Mr. Kanisak will talk about the development of healthcare system in Thailand. And I will be back to talk about the outcome. Thailand is a beautiful country in Southeast Asia. Bangkok is the capital city situated in the center of the country. Thailand is a multi-ethnic nation with a population of approximately 70 million. Thai is a national and official language with different dialects. The majority of Thais are Buddhists. Thailand is a constitutional monarchy with a democratic form of government. The Department of Corrections was founded in 20 October 1915 by King Rama VI. The department was first under the supervision of MOI, and later it was under the supervision of MOJ in 2002, with 143 prisons across the country, with currently nearly 270,000 inmates under custody, which makes Thailand one of the countries with the highest prison population. It is like you can see that we are in the world ranking, number 6 in the world, number 3 in Asia, and number 1 in ASEAN. I'm so proud. The most common type of offense is a drug offense, which takes up more than 82% of the prison population. The standard capacity of prisons around the country, ideally the bedding area is 2.25 square meters per person, is approximately for 165,000 persons, but now it exceeds the standard capacity for over 63%. That leads to several problems, include health-related problems such as contagious disease and sanitation. About the pain point of Thai DOC in terms of health in prison settings, there are several challenges that the DOC have encountered before the year 2018. Prisoners are a vulnerable group. As you know, they are at a higher risk of contagious disease due to prison overcrowding. Some of them are marginalized people who do not have access to healthcare services before intake. Lack of health literacy. Many people lack knowledge on self-care or general health, which lead them to living an unhealthy lifestyle, such as using alcohol and drugs before prison entry. And challenges number 3 is the prevalence of the TB, HIV, and non-communicable disease, mental health disorder, and mental problem in prison population is higher than in the community. For example, in 2020, the incidence of tuberculosis in the community was approximately 150 per 100,000 population, whereas it was over 1,000 cases per 100,000 in prison population. And number 4, prison clinic in that time were not registered to a medical institution under the Health Facility Act. The universal health coverage for every Thai national is provided by the National Health Security Office, including inmates in prisons, but the budget is not automatically allocated to where the prisoners are incarcerated. And number 6, the shortage of the service delivery from the primary hospital. The service were not delivered as regularly due to the hospital workload. The prison authorities had to hire a part-time doctor to deliver service to meet the prisoner's need. And a patient who is to be referred to the outside hospital need to be escorted by the two officers with limited manpower to escort the prisoner to the hospital. Only severe cases are referred to the outside hospital. You know that we can send all the prisoners to regular check-up every day. And Mr. Kanisak will tell you about the development of the healthcare services in prison setting.
Good afternoon, ladies and gentlemen. First of all, I would like to thank for giving me this opportunity to be here to share my experience about the development of the healthcare system in the Thai detention settings. Before I go in detail, I would like to talk about the basic or the background of the public health insurance in Thailand, and also I would like to talk about health delivery system in Thailand. Thailand has achieved universal health coverage by the year 2002 under the three main public health insurance, which consists of the first is the civil servant medical benefit scheme. This one covers the civil servant and dependents. The second one is social security scheme. Okay. This one covers the private employee in the formal sectors. And the last scheme we call the Universal Health Coverage Scheme, which covers the rest of the Thai citizens. With these three schemes, it was established in different years respectively. All three schemes cover about 99.9% of Thai citizens at that time. About 99.9% of 67 populations. Between the scheme, they have some different benefit package, payment mechanisms, and also managed by the three different public agencies. Based on universal principle, is to equally entitle all Thai citizens to quality health care and according to their needs, regardless socio-economic status. This slide shows the overall picture of healthcare services in Thailand. You can see the major providers are under Ministry of Public Health. At the all level from sub-district until the provincial level, we call general hospital, also tertiary care hospital. This facility provides the services both in the rural and urban area throughout the country. And also we have the other public hospital, for example, university hospital, military hospital, and also private hospital, mostly located in urban area, not remote area. All these health facilities connect to each other by referral system, which designed to refer the patient up to the high-level hospital where the patient needed, with more complex services or higher technology for diagnosis, or treatment from the specialist personnel. And also we have health volunteer, village health volunteer to do the activity in the village or in the communities, about 1 million village health volunteer to do the health promotion in the communities. I will talk about the management for the access to the healthcare services in Thailand. Thailand has emphasized on the role of primary care as a contracting model. So all Thai citizens or beneficiaries for each scheme have to register to the primary care provider, both public or enrolled private hospitals. We call contracting unit for primary, or CUP for short. And the contracting unit for primary responsible to setting the standard primary care unit we call PCU for short. This will require family doctors and healthcare teams, about 10 staff, responsible for 10,000 population for each team, to provide the healthcare services, including ambulatory care, health promotion, disease prevention, rehabilitation, health home care or home visit, and also community service in order to improve the health status. For the more complicated cases or the uncontrolled disease, they can refer to the higher level of the hospital, or maybe in the hospital or in the hospitals. I will talk about the function and responsible of the beneficiary, also contracting unit for family and the funder agencies. As I said previously, Thai citizens have to register to the main contractor or contracting unit for primary for the access to health services when needed. For the CUP, which is responsible to send the data of the member to the funder, and also the provide service data to the funder agency also. The funder agency will wire transfers of the budget to the providers monthly. We calculate by capitation per member and also by fee schedule fee, and also fee for service in some items, and for inpatients reimbursement also. So with this system, all Thai people access to the healthcare services with free of charge at the point of service. Anything they can get the service from the provider side with free of charge. I come to the challenges to the prison health. The challenges for the prison health in Thailand, according to Dr. Jutharas, has talked about the problem at that times. Because the prisons are under Ministry of Correction or MOJ. But most of healthcare workers and resource medical supply mostly under Ministry of Public Health. So what we do or how with that situation in the year 2018, only 7 prisons located in Bangkok. They covered by the General Hospital under Department of Correction Institute to provide both primary care, secondary care, tertiary care under the Department of Correction. But the rest located outside the Bangkok. Luckily, they have another seven prisons. They collaborate with the hospital at the local level. They can have primary care unit at that time, about 7. And only 1 under the private hospital to take care of the prisoners. The rest, about 129 prisons, just only have we call first aid unit provided by the nurse, only 1 or 2 nurses to take care all the time 24 hours. So when they have acute illness, they cannot provide the services. They have to bring out to the hospital. But with the limitation of the guard or the prison officer, they can take out only one or 2 prisoners per day, something like that. With that 10 points, it needs to harmonize the plan and implementation from the relevant organization. I think because MOJ cannot do the implementation for the healthcare services by themselves due to lack or limitation of healthcare staff in the detention setting, and also all resources for the medical treatment are sent to the Ministry of Public Health. About the policy, prison health policy of Thailand. Prison health is a priority in Thailand. I would like to say that. Accessing quality and affordable healthcare is the right in Thailand constitutional. In the year 2015, the Thai cabinet had approved to revise related law about prisoner rights, and including healthcare. Collaborating from stakeholders were assigned from the cabinet, especially MOJ, MOBS, and NHSO is the must for responsible for these problems. NHSO strategy also focus on vulnerable groups, especially prisoners. From that assignment from the cabinet, the interagency committee was started to work together at that time, but still slowly to solve the problems. The main objective of the interagency committees focus on consider the importance of promote mental health in prisons. The coordination of all relevant agencies and resource contributing to the health and welfare for prisoners is responsibility of the entire government. MOBS and NHSO provide and accountable for healthcare services for the detainees. To promoting and strengthening primary care in the prison is important driving force. Not only in the prisons, we improve the hospital outside the wall of the prison to set up the services for the prison separately from general population to reduce the stigma when they go outside to have the services in the hospital. So some hospitals in our country now today they have a special unit for the detainees when they go to visit the doctor outside the detention. What we do and how we have done from 4 or 5 years ago. How to set up? As you see, we have 3 agencies to responsible for at least three, NSSO, MOPS, and also private hospital, and also DOC. With the main 3 agencies, what we do, because all healthcare workers under Ministry of Health, but the detainee under the DOC, they are not freedom to go to see the doctor like the normal people at the outside of the wall of the prison. So what we do, NSSO accountable for fund management, MOPS accountable for provide healthcare services. How we can provide the service, healthcare services to the prisoner in the detention? We think that when we sit together at the meeting room, we think that MOU between agency, among the agency, is the most important to bring our resources from any part of services come together and work together, set the planning together. This is the most important thing in our country at that time, I think that. So, among the 3 agencies, we set primary care unit in another 129 prison, which still provided by nurse only first aid, to be improved as a primary care unit with the comprehensive services. We assign official signing MOU between 3 agencies on the year 2019, 22 of October. It means that we have setting fully primary care unit in the detention setting. What is the primary care unit working in the detention setting? located in provincial or district prison. They provide comprehensive primary care. All medical doctors come to the primary care unit at least once a week or more. All medical vaccine, medical supply come from the Ministry of Public Health hospitals. Emergency case can set up for ambulance, go outside at need. And also we have screening for communicable disease and chronic disease also. This one is the mechanism that we provide to the prisoner in Thailand. So I think with the MOU between three agencies, we can provide the services to the detainees in the prisons that can bring our country to achieve the universal health coverage for all Thai people. I think Dr. Turat will add more about the result. Okay.
Our clinic registered to be a primary care unit in 2018 and got the MOU for service delivery in the beginning of 2019. By the end of 2019, His Majesty the King initiated the royal project called Good Head Good Heart, with aim to enhance the healthcare service system in prison settings. In order Thai men receive the same standard treatment as the people in the community. The project focuses on different aspects of health, such as medical service delivery, sanitation, medical supply distribution, and personnel training. In the initial phase of the project, medical equipment and supplies such as X-ray van, dental units, and necessary equipment were distributed to 25 prisons and 12 local hospitals. The second phase in 2021, medical supplies were distributed to additional 19 district prisons and hospitals. During the outbreak of COVID-19, His Majesty King donated $1.4 million worth of medical equipment to DOC for providing health care for prisoners. And now we can see the change in health service delivery in prison. After the strong collaboration between DOC, MOPH, and MSSO, along with the support of the Royal Project, the healthcare service delivery in prison has improved gradually. As shown in the graph, the service delivery from the local hospital increased from 72 prisons in 2017 to 119 in 2022, even though this is number from only 4 months through. Each type of service, whether it is a general practice, psychiatry, and dentistry, also increased as well. By the way, I'm a dentist. As for the personal clinic, they are now all registered as a primary care unit or PCU and are regularly inspected to meet the minimum requirements in service delivery. Moreover, service delivery is set as a part of the KPI of the MOPH to ensure that the prisoners receive standard treatment regularly. In addition, the Department of Correction also works together with the Department of Health Service Support in developing curriculum for prisoner healthcare volunteers. Prisoner healthcare volunteers are prisoners who are trained to help the staff in basic healthcare. In the past, they were trained on the HIV and TB care. In 2018, MOU signed for standard curriculum developing. After the collaboration, they are trained in several aspects of healthcare, such as general healthcare, emergency first aid, basic life support, and signs and symptoms of common illnesses found in prison. Each year, the training courses are provided in prisons across the country. Now there are around 10,000 prisoners and volunteers in prisons who could help staff on basic healthcare. The outcome of developing healthcare system in Thai prison setting also shown in when COVID-19 attacked the prison population. The first confirmed case was detected in Narathiwat Central Prison, which is located in the southernmost of Thailand in April 2021, which later led to the first cluster in prison. Since then, the outbreak widespread to several prisons, especially during the Omicron wave, causing the outbreak and reinfection in many areas. The COVID-19 outbreaks have affected approximately 95,000 confirmed cases and 207 deaths, which is a 0.22% fatality ratio. This is a result of a good cooperation between the public health sectors. We support the medical teams and necessary resources. Under your project with Good Heart, we supported medicine stock, portable X-ray machine, and other necessary equipment. Both help prisoners to receive efficient and timely treatment, which reduce the fatality of the disease. The next step of developing the healthcare system in prison setting is to increase the capacity of active health screening, especially on arrival screening. More tailored benefit package for prisoners that is suitable for prisoner needs. Such benefits include TB screening, cancer screening, and of course, we're gonna develop the prison health big data. About the take-home message, what would you like to say, Mr. Kanisa?
I think to drive the detention healthcare services system, it cannot be success with just one agency. It requires cooperation from all relevant agencies, as I told you before. I think the MOU is an important tool for the systematic collaboration to bring relevant agencies to work together to set objectives and to share resources in order to achieve the common goal. Thank you.